So that's what these drugs do. They mainly increase the levels of GABA. Alcohol does that. Now, there are other neurotransmitters also that are activated and produced. We will talk about them later on, but the main core element here is the concept of GABA. GABA is increased, anxiety is reduced, no matter which one of these we take, and each one of them certainly has a different, if you will, nature to it, both in terms of accessibility, availability, affordability, and whether or not you need prescription. Such as you don't need prescription for alcohol. I mean, if you're 21 years and older, I mean, that's not a prescription, but legally a permit, right? You don't generally, even people who are minors, they can easily access alcohol because it's probably in their parents' cupboard. Now, alcohol we regard as depressant. This is a tricky one. We will talk about it later on, why initially alcohol is known not as depressant, but as actually something that, increases the energy and mood, heightens the sense of pleasure and easygoing, attitude in a person. How come? If it is a depressant, because that's the paradoxical issue here. When you tell people alcohol is a depressant, it's mind-boggling to them. They're surprised. They say, "Are you sure? Can alcohol be a depressant? Isn't it?" I don't think so. When I drink alcohol, I feel better. I feel more relaxed. I feel more outgoing. I feel more talkative. I feel more easygoing. I feel like things are okay, and I have more, sometimes even more energy to do things, So that's why it's paradoxical. They don't really understand how come that alcohol is actually a depressant. But we will get into that later on in another show in terms of this paradoxical effect.
We should probably have one just on alcohol and marijuana.
Probably. And that is that second substance that you mentioned, which is part of the depressant category, marijuana. Marijuana too, by the way, again, people are kind of puzzled by this. They think, are you sure marijuana is a depressant? Because initially, that's the difference. I think the reason people are mixed up about this is because both alcohol and marijuana have a different initial impact than long-term use.
Okay.
Or long duration of use. Long-term use can be regarded in two different ways. Like for instance, you could drink alcohol for an hour or two. But what if you drink alcohol for 12 hours? Consume alcohol or alcoholic drinks. What if you consume alcoholic drinks for kind of constantly for 12 hours or 24 hours or 72 hours? Right? That's long-term use. Now, there is another version of long-term use, which is what if you are actually an alcoholic and have been consuming alcoholic drinks for 10 years, right, on a daily basis, more or less. Well, that's long-term use, a very long-term use. That we will not talk about it right now. But what I mentioned between initial and kind of delayed, let's call it delayed impact. So both of them, alcohol and marijuana, initially have a little bit of a different impact, which is usually associated with that sense of what we call disinhibition. They have this disinhibitory impact that, and again, anxiolytic impact. They reduce anxiety and disinhibition and inhibition. So as a result of that disinhibitory impact that they both have, initially people think alcohol is an upper, right? It gets me up and running. It gets me happy. It gets me, it turns me into a likable person, more or less, right?
That's really common in the dating world, right? It gives me
Yeah.
the confidence to be able to ask that girl out.
Right.
And of course, we know the old story. The guy gives her a couple of drinks to make her more disinhibited.
Yes.
So it's kind of an interesting twist there. Yeah.
But then what happens after a few hours of using marijuana or alcohol? Then really the long-term impact of the substance shows itself. something that you didn't see in the beginning. What happens after that dating scene? There we go. People
crash.
more or less crash.
Yeah.
That's why it is a depressant. It's actually a depressant in the right dose. Now, if you kept drinking alcohol, let's say using marijuana in a controlled fashion, like you're just using it for half an hour, okay, and then that's it. You stop and you don't use it. Allow your body to recover from it, so you never fall into the depressant end of it, right? And then 2 days later, a week later, you use for half an hour or an hour, whether it is alcohol or smoke a joint or whatever, and then you stop using, and then you don't use it again for 2-3 days or a week or two, and then you use it again for an hour. Overall, over many weeks or months of doing this, you would never experience the depressant cycle of either of these.
Oh, really?
Right. And then you would think, oh, these are uppers. These are not depressants. Because you go back to your own original experience, which is very limited and structured in that way. But
Complicated.
that's very complicated. But generally,
Interesting.
People don't just drink alcohol for only a couple of hours. Unless, again, they're very disciplined. And we have maybe, 50% or more of the population is disciplined to occasionally drink alcohol, and they don't fall into the depressant cycle. Same thing with marijuana. If it is really just kind of dabbled into, probed once in a while, then people don't see the actual depressant cycle of it. But people who, let's say, are using marijuana really as medicinal remedy.
That's when it's usually the narcotic form?
Well,
Like a narcotic, I guess?
Well, not necessarily. Well, it can, and that's when you talk about some people being stoned. Not everybody has that experience, and being stoned is more being out of it, like as if you're asleep, because you're unresponsive. People who are stoned, they use marijuana, and they have a specific tolerance that has, kind of been taxed, and then they get into this spaced out state of mind. They're still breathing. They could respond to you, but it is, quite unintelligible. You don't know what they're talking about. They're in a kind of a different world or worldly experience. They're out of it.
That, yeah.
You have been accused of it?
I've been accused of that, yes.
With or without marijuana?
Without, actually. It's amazing.
Without. That's dangerous.
Yes, that's amazing.
It's like,
we'll talk about that in another special
without
issue.
cause.
Without cause. WC on the diagnosis
You want me
sheet.
to take your temperature?